I talked to our board of what I had seen. Our board was adamant that our patients would not be placed in that position.
We thought, going green would be good, but I wanted to go a little bit further.
From the first time I sat down with Vivian at Greenpower, Vivian told us she had a vision for San Benito Health Foundation. A super efficient, resilient, modern, critical care health clinic that could remain open during an emergency to serve her community when the grid power was down.
We've all seen that in '89 when the earthquake hit, people were devastated. And I just thought if that ever happened again, that this place, would be able to function.
In California, we had several fires last year, and many clinics throughout the state of California that were in those areas were affected by power outages. And they were basically dark during those periods of time.
So we're working on the infrastructure inside and as well outside with solar power, having a backup generator, and also installing a battery that would probably run the grid for about 10 days if there was no sun.
San Benito Health Foundation is the foundation of health for the community, and it started by a migrant population that saw the need to provide services that were not available. When people don't have power around us, we would serve as the place where people can come and recharge their cell phones so they could communicate and have water, things that we take for granted.
Now, by being California's first solar-powered, zero-carbon healthcare facility, all of us are ensuring that this community can rely on this foundation in bad times, but also in good times. You are now not only helping the health of this community by becoming more eco-friendly, you are helping the health of our Earth. Greenpower understands how important it is to continue the advocacy, but more importantly, continue to have these conversations so that other people start to make the changes that are necessary to mitigate climate change.
Climate change is a public health issue, from increased incidence of asthma to extreme heat that poses a threat to the elderly and vulnerable populations. And that's why it's critically important that health centers of all sizes make the transition to renewable energy to help mitigate climate change and also be ready to serve their patients and their community in times of crisis.
It's a way to assure our patients that they are taken care of. About 90% of our population are Hispanics and are people that do not have health insurance. So it's really a relief for them to know that they can get their services here.
In addition to that, our energy costs continue to grow and grow throughout the years. So we see it that at the long term, it will result in savings to the organization that we can further invest in direct service delivery.
We're constantly thinking about what things can we do that benefits our community, our patients. It makes me feel very proud, very good about belonging to an organization that is forward thinking in that respect.
So having health foundations taking affirmative steps to not just care for their patients full time, all the time, but to care for our environment, to me, this is an example that must be used throughout this state. It needs to be used throughout this country.
Being at the cutting edge of everything, we're going to be a clinic that's going to, set the bar for other clinics to meet or hopefully exceed.
It's exciting, and we hope that this will serve as a model for other community health centers throughout the region, throughout the state, and nationally.